You're walking through a parking lot, maybe around the block, maybe just down the hall to work, and at some point your legs start to go. Heaviness first, then tingling, and then that unmistakable numbness that makes you stop in your tracks and you got to grab and hold on to something. You rest for a minute, it eases. You start walking again, and within a few minutes, it comes right back. What's going on here? Does this sound like you? If so, watch this video because it's going to change the way you understand your body. I'm going to explain to you exactly what's happening when your legs give out on you as you start to walk at that exact moment. But I'm also going to give you a concrete solution action plan that you can start taking action steps today. My name is Dr. Alykhan Shariff. I'm a local chiropractor at Oshawa, Ontario, and my clinic name is Infinite Healing Chiropractic and Wellness Center. If this channel is new to you, hit the subscribe button now. We publish weekly spinal health education, and I want this to be your go-to resource. You may have been told, rest more, just walk less, just manage it. This is not good enough, and it's not accurate. Let me explain precisely what is happening in your spine when your legs go numb during walking, during any type of activity that you try to do something. You probably have a spinal condition called spinal stenosis. Stenosis simply means narrowing. In your case, the spinal canal, the tunnel that your nerve and your spinal cords run through is starting to narrow, which means your spinal cord is getting compressed, your nerves are getting compressed. And this can be due to degenerative changes, ligamentum flavum hypertrophy. It can be due to arthritic bone spurs. It can be due to disc bulges, disc degenerations. Any of that could be accumulating and building in your nervous system and causing your spinal stenosis. Now here is the critical piece, and this is the one thing that most patients have never been told. The diameter of your spinal canal is not fixed. It changes dependent on the position of your spine. What do I mean by that? Well, when you stand upright or walk, your lumbar spine moves into an extension position, and a slight backward curve happens, and the ligamentum flavum starts to buckle. That's lining the posterior canal, and it buckles towards the canal. The facet joints start to compromise together, and this starts to narrow your canal. That's why when you get up and you start to stand and you start to walk, you start to feel that compression. When you lean forward, sit down, or flex yourself forward, the ligamentum flavum, well, that stretches flat against the canal wall. So it gets away from the canal. The facet joints start to open. The canal diameter starts to increase, and the nerve starts to decompress. The spinal cord starts to decompress. That's why leaning on a shopping cart sometimes can feel good. That's why sitting down gives you relief within minutes. That's why leaning forward on your desk could also help too. This is not a coincidence. This is spinal physics. The symptom pattern you experience, leg heaviness and numbness, building during walking, and it's relieved by stress or forward flexion, has a specific clinical name: neurogenic claudication. Neurogenic means it's nerve-related. Claudication means that it's difficulty walking, limping. This is one of the hallmark signatures of spinal stenosis. Now, I want to address something specific that patients here at this clinic at Infinite Healing Chiropractic and Wellness Center ask me. Why does it get worse over time? Why does it get worse over a course of walking? Why does it come on faster some days than others? The walking distance that you manage before your symptoms is what we call walking tolerance. And it's directly tied to how compressed your spinal nerve roots are and how quickly that compression builds up under stress or under a load. When you start walking, your nerve roots are managing the injured canal space. And so it depends on how compromised that space is. Blood supply to the compressed nerve roots become progressively impaired as well. The nerves begin to build up inflammatory signatures in there too, which leads to leg heaviness, tingling, numbness that builds up. And that buildup can be slow, can be fast. It really depends on your day-to-day variation. In certain days, you may have so much inflammation built up in there that you're already compromised to begin with. So you go to start that day, and instead of you lasting like 5 minutes, you may only last 1 minute. You've been sitting for long periods of time and stuff, and that's great. But then when you go to stand up, you feel it. Maybe you've been on your feet all day, or you've been commuting for long periods of time. And when you're commuting, you also got to understand that how is that chair structured? Is that chair an extension? Well, remember what I said earlier, extension is not the best thing for your lumbar spine. So if you're commuting for long distances and your spine has been extension for a long period of time, well, you're already compromising your nerve roots. So now when you try to get out of that car, bam, you're feeling it. Your legs are going to go on you. You may have to grab one leg and bring it over and bring it out to get yourself out of that car. This is what starts to happen, and it can vary day to day, time to time. This can start to affect your ability to work, to shop, to participate in your family life, to even just live a normal life. And left undressed, the trajectory is not neutral. It can start to accelerate. The walking tolerance can start to decrease. The muscles can start to get weak. You start to decondition. And now it becomes a cycle that's building, a snowball that's building, and things are just getting worse. And the simplest mechanical load is difficult for your neural tissue to handle. Today is a time for an action plan. I'm going to give you 4 concrete steps that you can implement starting today. Action step 1, the 3-step walking reset. This is the single most important skill change that anyone with neurogenic claudication needs. Most patients push through the numbness and tingling, and that is a wrong strategy. By the time the symptoms are significant, your nerve roots are already under significant pressure. Pushing through compounds the irritation and reduces how fast you'll be able to walk on your next attempt. Instead, stop before your symptoms peak. The moment you feel the signs of heaviness or tingling building, stop. Don't wait until you can't take another step. Lean forward. Place your hands on your thighs. Lean against a fence. Lean against a bench. Lean against a shopping cart. Create that lumbar flexion and open up that spinal canal. And hold it for about 20-30 seconds. And then resume walking with a slight forward lean. You don't have to completely dramatically lean forward, but just a subtle lean is going to start moving that lumbar deflection, and you can start walking. It's like the shopping cart posture, is you're going to have that, and you're going to walk with that, and that's going to help keep your spinal canal decompressed. Action step number 2, seated knee to chest exercise. You're going to perform this exercise, and it's a very simple exercise, and I'm going to show you how to do this. Okay, so for this action step number 2, what you're going to do is it's the knee to chest exercise. So basically you're going to be seated, and all you're going to do is you're going to bring your knee to your chest. You're going to grasp with your fingers below the knee along the shins. So you're going to bring that up, and you're going to hold this for 15 seconds. And hold, hold, hold. And this is a great stretch to do before you start walking. Really helps to loosen that area up. Really helps with that lumbar spine, opening up that canal, reducing the stress off the pelvis structures as well as the hip flexors. And you're going to switch sides. Same thing. Hold, hold, hold. 15 seconds. You want to do a minimum of 3 times on either side. And great to do it right before you start walking. Action step number 3. Double knee to chest. This exercise is a great exercise to do. You can be on the floor, have a nice yoga mat underneath you. You can do it on a mattress. You can do it on a table. I'm showing it on a chiropractic table right now. And basically all you're going to do is you're going to have your lumbar spine flat against the floor. And basically you're bringing both knees to your chest. You're going to grasp with your fingers below the knees, and you're going to bring those knees to your chest. Now, important, let gravity do the work. Do not push it. Let gravity do the work. Hold this nice 15 seconds, and this really helps opening up that lumbar spinal canal. And then once you held this, you just relax, and you're going to repeat. That lumbar spinal canal decompression that's achieved with the double knee to chest is done, I would say always do it morning and do it in the evening, always. When you get up in the morning, do it. Before you go to bed, do it, hold it for 15 seconds, and you want to do it 3 times. Action step 4, walking goal strategy. Do not measure walking success by distance. Measure it by symptom-free time. If you can walk for 4 minutes before feeling any symptoms, that's your baseline. Then the goal is to expand that window through consistent application of the walking reset and the stretches that I've given you. Slowly over time, you see gradual improvement and your body gets stronger. Now, I will say, as I say to anybody, if you are having these type of stenosis symptoms, you should be doing these 4 action steps. But you should also understand that you should also be seeking care. You should be seeing a chiropractor. You should be seeing somebody that has an understanding of spinal stenosis and how to treat it and how to help it. Because the care that you get on top of those action steps helps you to accelerate through that therapy plan. I have patients that come to me from Oshawa, Whitby, Bowmanville, Ajax, Clarington, and Curtis and stuff. And all these clients that have spinal stenosis will be given these action steps, but more importantly, be given therapy where I'm improving the motion of those spinal joints. And by doing that, and by the chiropractic adjustments, I am taking pressure off of those nerves, pressure off of that canal, pressure off of that spinal cord, and allowing free-flowing motion happening in that nervous system, which can only facilitate and help you in the process of managing this condition. So if your legs are going numb when you walk, book a consultation. See somebody to get this addressed, and don't manage this alone from a YouTube video. Get a proper assessment. Get a care plan designed around your specific presentation. If this video gave you a clearer picture of what's happening in your body, then please like it, share it. Share it with somebody you know who's dealing with the same thing, and leave a comment below telling me how far you can currently walk before your symptoms appear. I read every comment, and I will also make sure I respond to everyone too. Subscribe to our channel. If you haven't, now's the time. Don't miss the next video that's coming out. My name is Dr. Alykhan Shariff. I'm a local chiropractor at Infinite Healing Chiropractic and Wellness Center. I'm located in Oshawa, Ontario. See you on my next video.